At a time when most Ugandans have been accustomed to the fact that HIV infections are ever on the rise, it would not have been a surprise to find out during the annual HIV and AIDS review that all is grim. But it has been somewhat immense news that was delivered by the Uganda AIDS Commission.
Now we are at 140,000 people who got infected last year. The previous year it was 160,000. We have been getting 23,000 new babies born with HIV. The figure had even reached nearly 25,000. And last year, the number was 15,000. We want to drive that number to zero.
USC attributes the breaking of the bond of the epidemic to the efficacious interventions.
People getting on treatment have increased. People being tested have also increased. Pregnant women who are HIV positive and coming for services, that has also improved. So, people who are being circumcised, that figure has also gone up.
Which of course does not make you iron.
The AIDS development partners have applauded the progress made by Uganda.
But now is not the time for complacency. We are at the tipping point. This is the crossroads. And therefore now is the time for the government and its partners, and I'm including here us as development partners, to redouble our efforts.
In making strides in reducing the virus load and reducing deaths, about 200,000 people have been put on ARVs. Only 23% are waiting. The ministry hopes that 240,000 more will start ARVs this coming year.
For the first time, we have got more people enrolling on treatment than the number of new infections.
If you put people on treatment, you reduce their chances of transmitting the virus by nearly 95 to 96%.
According to the WHO recommendations of starting the infected on treatment at a CD4 count of 500, the Minister of Health has already approved this.
We would like to have more money and more drugs so that we don't even look at the white cell count, the so-called CD4.
Put more emphasis on HIV prevention in order to turn off the tap that is causing the flood of new infections, because it will be very difficult to put and keep all those eligible on treatment.
All this is aimed at reducing to zero the HIV deaths for those who are positive. Since 2002, about 100,000 HIV and AIDS Ugandans have been dying each year. This number has now reduced to 63,000 with each passing year. This was possible because of the uptake of ARVs. However, these are drugs that one can only take when they know their HIV status, and so most Ugandans are encouraged to test as early as possible. Florence Nalimba, NTV.